My name is Jonathan Flores. I work as a physical therapist in the outpatient setting. Basically, my patients come to me. You might have different other physical therapists that actually work in like hospitals or nursing homes where they're actually in the hospital and they go to patients' rooms to evaluate and treat their conditions. A typical day for me at work is I come to work, I look at my schedule, I communicate with my front office staff and my other assistants if needed, and then any other therapists around. My basic day runs between 8 to 9 hours a day. For example, a typical day or typical morning of mine, I might have a new patient from like 8 to 9 o'clock, for example, and I would evaluate them. I would assess their condition. I would use specialized tests, do a specific history examination, assess their condition, whether it's been operative or non-operative. Then I would, explain them the plan and educate them with what's going on with their pain or injury. And after that, I would, set them up, depending on what I plan for them, or take their objective findings and actually put them on a program which may consist of 3 times a week for 4 weeks. And then the next hour would be like, for example, 9 to 10 o'clock. I might have 2 patients here waiting for me. One could be a shoulder patient, one could be a knee patient. On that day, I might, depending on what's going on, progressing through a customized exercise program, which may involve some type of plyometric activity, jump them up and down a box, or balance activity for the knee patient. Or for the shoulder patient, if they're a baseball player, I might use specific throwing activities to improve their ability to throw. And in addition to, we utilize, as physical therapists, specific manual therapy techniques where we, very similar to chiropractors, they call it manipulation. We physical therapists call it joint mobilization. We might actually improve their range of motion by using specialized manual techniques to improve their motion for their knee or shoulder. In addition to, at the end of treatment, if they're a little bit more painful, we could use electrical stimulation and ice, or if they have inflammation, we use modalities called iontophoresis, which actually uses medication that's prescribed by the physician that we can actually transdermally use e-stim to reduce inflammation in that area. In my business, or in the outpatient setting, we have to be able to multitask, come from one patient to the other, maybe setting up patients on different types of modalities like electrical stimulation units. We also utilize specialized manual therapy techniques to actually improve their range of motion, decrease their pain symptoms, and also we follow strict guidelines as far as any type of surgical protocols for that. Another important part of the job is to document what we've done, whether it's an evaluation or a treatment. At the present time, insurance companies are very strict on us, trying to figure out what we did to their patients so that we can be reimbursed for the services that we provide. Therefore, we have a medical documentation system that we actually do on every patient every day. In order to become a physical therapist, you have to have a degree in physical therapy. Most programs at the present time most of them, like 90% or more, are Doctor of Physical Therapy programs, which are graduate programs. And certain schools have them, certain schools don't, similar to medical school. Most of the requirements to actually apply to their programs require a baccalaureate degree in any field, but they have certain prerequisites like, for example, one school might require 2 college chemistries, 2 biologies, 2 anatomies and physiology, 2 physics, and a lot of those need the labs required with them, in addition to statistics, calculus. And some higher or some schools require organic chemistry, but not all. In addition to, they require some type of volunteer work in multi areas in physical therapy clinics, whether you're in the acute care, nursing home, or rehab center, or home health arena. A lot of the programs, or most programs, require a GPA of 3.0 or higher. In addition to, you have to take the GRE, which is the Graduate Record Examination, and scores are typically recommended to be 500 or higher in each section. In addition to, as far as any other type of recommendation letters, some schools require recommendation letters from either past professors or other physical therapists or someone that knows you really well for years. After you graduate from physical therapy, typically you have either a master's or doctorate of physical therapy, and you take a national board examination, which is computerized, and each state requires a different score to be practicing in each state. Also, most states are requiring you to pass a state examination, including the national board examination, to be licensed. More importantly, also as you're going to PT school, you will be involved in clinical internships at different arenas of physical therapy, like outpatient physical therapy, the hospital environment, and rehab centers. The best part of my job is actually working with patients and watching an individual that couldn't walk before and then can walk without any kind of pain or deviation after 4 weeks. The worst part of this job actually is the medical documentation. Medical documentation, you can bring that home, and it can take an hour or 2 of your out of clinical or out of patient time. My final advice is to actually, for anybody that wants to go into physical therapy or become a physical therapist, to actually shadow a physical therapist in different arenas. Like, I work in the outpatient physical therapist setting. We have a lot of high school students, college students who actually shadow me or do volunteer work. Also, you want to go into different types of arenas like the hospital environment, the nursing home environment, and maybe talk to a home health therapist and shadow them, and actually talk to them, and get out, see what their typical day is for an 8-hour day or a week, because sometimes it can be more challenging than you think it is to work with patients or to examine them or use your clinical background or all the studies you have finished or completed